catch up if they do come in, okay? Remind me of your name again? Melanie. Yes. Okay. Melanie, Mary Jane, Lena. Got it. Okay, so this is us. As you can see, me on the right, Leanne on the left. We're a couple of the pharmacists. We have another pharmacist here as well, but you'll always see us here. So you can always come in, ask us questions, give us a call, and this just has our information. This is a medical disclaimer, providing this is information for you. Obviously, we'd want to check with the doctor or any of your doctors about the different things that we're going to be talking about today. Learning objectives. So I kind of just want to give y'all a preview of what exactly I'm going to be talking about. And y'all obviously know the main topic is inflammatory bowel disease. But we're going to kind of dive into the different types and what it looks like symptom-wise. We're going to look at conventional treatments, so what's out there, what you'll most commonly hear from doctors, and then we're going to kind of flip it and look at more of an integrative, okay? An integrative approach that we try to take and we try to look. And they don't have to be mutually exclusive, okay? So just because you may take a prescription medication a more conventional way doesn't mean you can't have an additive of the integrative side. And that's what we really promote is, let's make sure we're getting both sides of things. And then lastly, we'll really talk specifically about low-dose naltrexone, which is a prescription medication that is more on the alternative side of use, but there's a lot of research, especially in IBD, okay? So we'll talk about some of that. So inflammatory bowel disease. Essentially, the biggest thing I want y'all to know is that it's an autoimmune condition is where it's coming from. You may ask, well, what is an autoimmune condition? Essentially, it's your body abnormally reacting to different things in your body. So essentially, it's not recognizing your own body as self, and it's attacking your own organs, whether that can be your thyroid organ, it can be in your gut lining, which is what we're talking about today. It can be in your joints, rheumatoid arthritis. There's a whole slew of them. And the biggest thing that I really like to tell people is the unfortunate thing is once you get one autoimmune disease or one autoimmune condition diagnosed, what we see is that maybe you'll over time collect 2 or 3 different ones, okay? Because it's really about the source, the inflammation. Your body is ramping up inflammation and it doesn't know how to turn it off. And there's a whole bunch of different reasons for why this happens, but that's really what I wanted to convey here is that, it's having that chronic inflammation going on throughout the body. A little bit of inflammation, getting sick, having a fever, those kinds of things are normal and okay, but when you have the chronic inflammation is where we get into trouble. And really, our job here is to minimize your inflammation so that it doesn't lead to other autoimmune conditions, okay? Different ones for inflammatory bowel disease. We have Crohn's disease and we have ulcerative colitis. Those are kind of the 2 different ones. The Crohn's disease, that can affect your whole entire GI tract. A lot of times it's more patchy in its effectiveness, so it's not necessarily throughout, but you'll see patches of it affecting it, especially when you see imaging of your GI tract. Ulcerative colitis, more affecting your large intestine or your colon area, so the end of your GI tract or digestion, okay? This is kind of back to what I was talking about with the inflammation, talking about acute versus chronic. So chronic inflammation, it's our foe, no good, linked to major health conditions. Like I said, different things that can affect your heart, your brain, your skin. Today we're talking specifically about the GI tract, okay? One autoimmune disease can lead to a whole bunch. There's over 100 different types of autoimmune disorders. It's actually, the research is kind of crazy. You have people affected by cancer, people affected by heart disease. Autoimmune actually leads these. leads even heart disease or cancer as far as affecting people. And I'll tell you, I started here, it's been coming on 4 years. And before I started, I knew about autoimmune conditions because my mom has rheumatoid arthritis. So like I was aware they existed, right? In pharmacy school, you learn about them. But I was just amazed at how many people coming through the door and telling me I have Hashimoto's or, one after the other, Sjogren's, all these different autoimmune conditions. And I was amazed. And then you had people with 2 or 3 and really seeking help from us because, it's just affecting so many people. So that's why this stuff is so important. Crohn's disease versus ulcerative colitis. I really won't get into it too much, but it's in your notes. We kind of talked about the big ones. Interestingly enough, what I really found interesting, this was in pharmacy school and now, but for Crohn's disease, smoking increases your risk. For ulcerative colitis, it's actually protective. Now, I'm not condoning smoking, but I just think it's an interesting thing to see. So smoking, like cigarettes and nicotine, is actually protective in ulcerative colitis. But then with the Crohn's disease side of things, it's an increased risk for, aggravating and agitating it. Now, we know that smoking is bad in so many other ways, but it's just an interesting little tidbit. This is kind of what I was talking about with the patchy appearance throughout the system versus ulcerative colitis towards the end, kind of all congregated into one. Incidence. In 2015, an estimated of 1.3% of U.S. adults, or 3 million, are reporting to be diagnosed with IBD. This really, I got this from the CDC website. It was the most recent statistics they had. And as you can see, there's other things, 45 years or older, Hispanic or non-white Hispanic, less than a high school level of education, not currently employed, born in the United States, living in poverty, living in suburban areas. Kind of interesting, but things to think about. Environmental toxins, okay? When I'm looking at, okay, why are these people more at risk than others? We got to think about environmental toxins. And probably one of the biggest thing that probably pops out to me is going to be diet. So, being able to afford good quality foods may be an issue for some of these people that are in these areas. So, we have to think about how maybe increase processed foods, and that may be playing a factor as well. So this kind of leads us to our causes. Genetics. Genetics can definitely play a role in the fact that it's really interesting. You actually have genes that are going to code for your immune system. And they will essentially depending on what yours looks like, it could either be saying, let's ramp up inflammation really quickly and aggressively. In those people, usually they have really bad allergies. That's a symptom you'll see. And then you also have a side of genes that actually don't turn off that inflammation properly. And in some people, you can have aggressive turn on and a really bad turn off in that combination. So it's not necessarily means you're set up to fail. It just means you have to kind of think of your bucket already a third full when your genetics are already there, setting you up for possible issues. Different endogenous factors, impaired immune function. Another one is, poor epithelial function, or, your gut lining is worn out. Environmental factors. Definitely the first one, okay? Any sort of viruses, any sort of imbalance in bacteria, infections. A lot of times even childhood infections play a big role in things that happen later in life and autoimmune conditions. Smoking, stress, very big one that we may not always think about, but trying to minimize stress, there's a big component there in flare-ups and symptoms in high times of stress. And then lastly, like I talked about with diet, in America. We have the SAD diet, or the standard American diet, usually comprised about like 60-something% of processed foods. Then we have our protein, our animal products. And then lastly, we have our vegetables or fibers. So that a lot of times can definitely impact it. I just wrote a little thing here. IBD is different from irritable bowel syndrome and celiac disease. But you know what? A lot of these things that we're going to talk about today can apply to those other ones. So I like to mention that it's different, but it still has the effect. And a lot of times you'll find that you go to your doctor with some sort of gut symptoms. A lot of times they'll try to cross off these different things, and then they'll diagnose you with IBS. So that's a very, very common of, okay, I'm having these gut symptoms and they don't really know exactly what to call it, and that's what you get diagnosed with. So something to keep in mind. So conventional treatments. I won't say these, but very commonly you'll see the top two are very, very common that you'll see a lot of patients on. A lot of times the corticosteroids are going to be either given locally for ulcerative colitis. That could be more long-term, but a lot of times is during flare-ups. And that's what I see a lot in my patients is, oh, I'm currently on a steroid because I have this flare-up. But the issue is they then come in with a whole slew of side effects. They can't sleep. They're gaining weight. They're hungry all the time. Even anxiety and that kind of feeling as well. Yeah, exactly. So always things. Then you keep going down the list and kind of affecting your immune system even more seriously, okay? In the fact that they actually suppress your immune system even further, because the issue with autoimmune is your immune system's attacking self. So we have this idea of suppressing the immune system. Well, what's the problem with that? Problem is infections. Very, very much higher risk of having a flu, a cold, and it affects you a lot worse. And I know this firsthand from my mom taking these, biologics for many years. She tried different ones, and, if she got a cold that I had, oh man, it put her out for way longer than it did, any of my other family members. So we had to be very careful to kind of try to stay away when we were sick. So these are all things to keep in mind. Even further down, surgery, really a lot less common, thankfully, but that's when you'll see where they're actually removing part of the gut lining that is so inflamed and essentially causing so much issue that they just remove it surgically. Well, that causes problems, because then you're not having a full functioning gut. Sometimes they have like ileostomy or colostomy bags, which is another impact on your daily life. So I know this one's blurry, but essentially showing the same thing of there's a mild and you work your way up to those different treatments. I like this one. This is my pharmacist brain loving this one. But essentially it shows kind of where these are going to work and why you would see them used for different ones. So, the ones at the top are more to be used for the Crohn's disease because it works throughout your gut. The ones at the bottom are more going to be the ulcerative colitis because it's at the end of your GI. So I just threw this in there because it's a cool little diagram. So let's kind of talk about integrative approach, okay? We'll go through different things that we can offer, but I like to talk in very generality as well of what things you should be focusing on. So definitely dietary plan. Okay, and really focusing on your dietary plan. It's going to be different for every person, and you can read about a billion different things about how you should eat and what you should eat. But the best thing is to really pay attention to how your body reacts to certain foods, because you may find that this fruit or vegetable that you eat that's supposedly, good for you is actually causing you to have symptoms. Maybe the next day or the next couple days, then you have loose stools or something like that. So it's really about, when I say dietary plan, focusing on what is inflammatory to you. We'll kind of get more into the testing that we offer that can help guide you a little bit closer, considering a lot of people are not necessarily in tune with your body. Some people are great. Some of my patients can tell me exactly what's going to cause what, but others are like, I have no idea and I don't know where to go. So the next one on here, stress reduction plan. Like I said earlier, giving yourself 15 to 20 minutes every day. That's what I challenge my patients when they come and see me and it has to be a stress relief for what is stress relieving for you. It's different for every single person. Someone might want to take a bath and listen to music. That may bore someone else crazily. So I say, hey, go for a walk, but don't be thinking about your to-do list in your head. So definitely stress reduction. Next one on here, endocrine balancing or hormone therapy. I am very much about treating the patient as a whole. So you don't want to focus just on one thing. A big part of it is stress. So looking at those adrenals, seeing what your cortisol or your stress hormone levels are throughout the day, and if those are either too low or too high, because that can definitely impact not only your energy to want to make these changes, but also your inflammation going on in your body. Supplemental support. So we'll go through some of these, the top ones that I really recommend for gut support. Okay, this is talking about decreasing inflammation, balancing out your good and your bad bacteria, healing that gut lining. That's a huge thing. Is we talked about the epithelial structure earlier, and really helping with any sort of intestinal permeability problems, or what we like to call leaky gut. Okay. Next one, antibiotic, antifungal, antiparasitic. Like I said, it's not just one or the other. They're not mutually exclusive. So we can kind of look at both issues, and if you're needing certain therapy, okay, well, you need an antibiotic because you have an active infection going on. Well, that's okay. Let's just make sure that, at least separated by 4 hours, let's get you that probiotic, and let's get you a good big old dose of it, because you're killing off your good bacteria in addition to your bad bacteria. Antibiotics don't differentiate the two. So lifestyle changes. So avoid smoking, absolutely, definitely inflammatory for you in so many different ways. Reducing alcohol consumption, same reason. Not to mention, it's very, a lot of the alcohol is fermented. We get a lot of possible yeast overgrowth. They love to grow in that kind of environment. Lots of sugar in the alcoholic drinks. So looking at reducing that. Avoid NSAID use. That is just one of it. A big issue is chronic pain. So you'll find some patients that will use over-the-counter ibuprofen and not realize that it's causing an issue when they're using, 800 milligrams every day. Definitely can impair your gut. Spicy and fried foods. It's your body, it's hard to digest those. So that's just where it comes in. And incorporate additional fiber and omega-3s. So these would be some that I would definitely recommend. Fiber, you can find tons in your diet, but definitely omega-3 fatty acids. Yes, increasing fish consumption does help, but we're looking at much higher doses needed to really target the inflammation. So recommend, that's one of my top 5 supplements kind of to get healthy and stay healthy is omegas. Getting to the root of the problem. So these are kind of going to become a little bit repetitive, but really just kind of ingraining, obviously you're having these symptoms. Obviously you're having this autoimmune condition that your body is attacking. that's the problem, but there's also something else causing the inflammation. So look, that's where we come in is, okay, let's evaluate the food. What kind of food's causing inflammation? Is there intestinal permeability, or is there leaky gut where the food that you're eating is actually leaking into your gut? So guess what? Of course your body's going to be inflamed because no matter, that food's not supposed to be there. So essentially it's saying, okay, I need to attack that and get rid of it. And it just ramps up your chemical messengers saying, let's get rid of this. Environmental toxins. This one's a huge one that I personally worked on because before I worked here, you don't think of these things, but even just cleaning out your household, your makeup that you wear, the laundry detergents that you use, with all the crazy fragrances, definitely house cleaners, getting organic spray, they don't need to use those pesticides, especially in the house. And then what are some other, the lotions, the list of chemicals on the back of those are just so long if you take the time to look at them. So, and there's so many good alternatives these days. Chronic stress. So definitely, like I said, some sort of stress relief in your life, 15 to 20 minutes a day, and really focusing on that time. Could it be poor sleep? That can be a result from stress, the cortisol, that can be hormones being off. But, that could cause fatigue throughout the day, and just, it's very inflammatory because so many things get regenerated when you're sleeping. Excuse me. Blood sugar imbalances. That can cause inflammation in itself. You see how some patients who have let their blood sugars go crazy high, in the end of things, they may get an infection in their leg or something that requires serious surgery. So things like that you have to think about. The reason why that happens is really the inflammation. And then any underlying infections. So we're talking about parasites, viruses, bacteria, just overproduction of bad bacteria. So moral of the story, health begins in the gut. So I think one of the most staggering things is that 60 to 80% of your immune system is located in the gut. That is crazy. I remember the first time I heard that, I was just amazed. Not to mention how when I learned that the good bacteria in your gut are responsible for making so much of your neurotransmitters that affect your mood, that affect sleep. It's just crazy how much your gut has a role in this. And so a lot of times when a patient comes to me, this is kind of where I like to start, is because if we don't ever address that, we're going to kind of try to be playing catch up. So this is kind of where we're talking about healthy gut versus leaky gut. The things that can cause leaky gut, it's very additive, but the pathogens, the nutrients, looking at having antibiotic therapy, like for long-term infections, just sickness in general. But you can essentially, as you can see over here, healthy gut, there's not a lot of room. These are called tight junctions, so they're very close together. When you go over to the right side and you see, okay, long-term NSAID use, stress, toxins, even like inflammatory diet, that kind of thing, you can get that compromised. And that's where you see the foods you're eating, the meds you're taking, the chemicals you may be putting on your body leaking in and getting into your bloodstream, causing further inflammation. Okay. So this kind of leads me to, okay, this is the more targeted, let me find what foods may be inflammatory for me individually. So we offer this food sensitivity testing. It does 132 different foods. It also looks at some additives, and also very importantly, it looks at candida. So seeing if there's some sort of yeast overgrowth going on as well. Really, I like this because the results. It actually stratifies them out in 5 different categories. Green node reaction, all the way up to red with a severe reaction. So you're able to really concentrate on those big ticket items like the red, orange, and the yellow, okay? Then those are the ones that we recommend eliminating for 6 to 8 weeks, okay? And taking those out of your diet. Then once that period is over, adding one food back at a time and essentially evaluating. When you remove those food to 6 to 8 weeks, if you're having inflammatory symptoms towards that food, when you reintroduce it, it's definitely more apparent to patients when they reintroduce. It's and you do one at a time, giving yourself about that 3 to 5 day spacing in between to really evaluate. We've had a lot of success with this testing and finding that patients just feel so much better when they're eliminating the foods that are highly reactive for them. And really, the way the technology of this testing is awesome. They actually look at your IgG antibodies. Okay, this is sensitivity, so not allergy, not allergic necessarily, but what your body is essentially creating these antibodies towards these foods, which then creates it also tests for a complement is what it's called. And so it tests to see if that's also happening, which then when that happens, it recruits all those chemical messengers to amp up inflammation. So it's almost testing the degree of that. So very cool stuff, and really nice how it stratifies it out for you. Once we get the test results on those back, depending on how many there are and what your most troublesome symptoms are, we recommend also supplements on the side depending. It's different for every patient, but these are the 5 R's to gut repair. It's going to be the big thing that you do here. So remove the inflammatory foods. That's going to be your first one, okay? Replace. That's going to be replace your digestive enzymes. So that first picture here, that Vital Zymes Complete, that's something that I definitely recommend for a lot of patients. You take it about 30 minutes before a meal. It really helps if you don't have enough of those digestion proteins to really help break down your foods. Other one, reinoculate. So that kind of leads us to the Flora Balance Max, which we have tons of different probiotics, but that's one of them. So making sure to give your body that good bacteria and balance it out with the bad. I recommend rotating your probiotic every couple months. Usually I say buy a probiotic, finish that bottle out, and then go to a different one. The more diverse the probiotic, the better. The more diverse you are in your gut as far as good bacteria, the better as well. Okay. Repair. So that really comes down to repairing your gut lining. There's a couple different supplements. I like the L-glutamine because not only does it help repair the gut, but has a lot of antioxidant potential. But also immunoglobulins. It's a big word for essentially it also helps repair your gut and actually also helps remove bad bacteria and even yeast or candida from the gut as well. So that's kind of one I turn to first, and then on a maintenance do L-glutamine. And then rebalance, that kind of goes into making sure we're looking at you as a whole. Okay, if we've started with the gut, now let's make sure your hormones are balanced. Let's look at your adrenals, your cortisol. Let's look at your thyroid. Is that an issue? Just as a whole, making sure we're not missing anything. Because fortunately and unfortunately, we are very complicated and all these systems talk to each other. I just want to present a few other testings. We actually don't do this one. We have the ability to, but I just think it's going to be kind of what's like up and coming and you'll be hearing much more about. But essentially, it's actually testing your stool to see what your specific bacteria is composed of, both good and bad. And then what it'll actually recommend supplements necessary, but also looking at the food side of things. So looking at the foods that contain these bacteria and which ones you should be eating more of and which ones you should be eating less of. So very targeted of looking at your diet as well. Some other testing that we offer and that I think is important and plays a role in all this is adrenal stress testing. So that's your cortisol. The gold standard is going to be saliva, and you look at it 4 times throughout the day to see how it fluctuates throughout the day. Should start highest in the morning and low in the evening time. I've seen patients flip-flop. I see highs, I see lows, all the things, but really using that to use targeted supplement therapy to help balance that out. Fatty acid analysis. So this is actually going to help guide omega-3 or fish oil supplementation. Not only supplementation, but your diet. Looks at your balance of your omega-3s to your omega-6s. Very cool stuff. And it's actually also a finger prick on that one too. Genetic testing, so taking your genetic results and using that to optimize your nutrition or your supplements. We do that. I have patients like with 23andMe or Ancestry that will bring me their results, and we actually have a program that we can integrate those results in, and it will actually say, less likely to absorb vitamin D. That's something that they pull from genetics. There's also, we have a company called GX Sciences that we do certain nutrition panels. One of them is autoimmune. That's specific for it, and they recommend different supplements to support these pathways that may have issues, kind of like what I was talking about with the ramping up of the inflammation and not being able to turn it on or not being able to turn it off. Micronutrient testing, this is probably, it has such a big role here because guess what? If your gut's not if you have a lot of inflammation, if you're having issues in your gut, you're probably not absorbing the nutrients from your diet and even possibly supplements. So the micronutrient testing would be something that I would recommend, to see what kind of maintenance you would need as far as supplements or, even looking at what to increase in your diet. This testing is really cool because it's testing more of what's in your red blood cell versus just what's in your blood. So it gives more of a look over 4 to 6 month period versus a moment instantaneous in time. So I always like to tell patients it's like a glucose level when you go to the doctor. Guess what? If you had a strawberry before you got your blood taken, your glucose level would be high. But then if they would do a hemoglobin A1C, which tests that red blood cell and looks over 3 months, it would probably not reflect that because that was over 3 months, what was your sugars running versus that one moment in time. So this is really cool because it doesn't change from moment to moment. It would take around 6 months of supplementation to really see these numbers change. So it gives you a good idea of where you're running overall average. And it kind of graphs it out for you of, like this is vitamin B1, so it's showing they're deficient in that. Magnesium, they have adequate magnesium. Very, very visually pleasing and gives you good information. So kind of summing up complementary and alternative medicine therapies. So we've talked about probiotic. Some other ones I want to insert in there are really going to target inflammation. So curcumin or the turmeric, really good antioxidant, but just really good for overall inflammation throughout the body. And it's actually very good for detoxification as well, which I learned not that long ago, which was very cool to see because we get a buildup of a lot of this. And next one there is our fish oil. So we've been talking about that. It's good for your brain, your heart, your skin, but definitely also inflammation. Inflammacore, that's actually a protein powder that, it would be a meal replacement type of thing. And essentially it has a whole bunch of different anti-inflammatory factors in that one specific protein so that you could integrate that as a meal replacement. Essential oils, I've listed a few of those that are very good for inflammation. These wouldn't be necessarily focused on gut, but other areas of inflammation. Another big one is CBD oil. I don't know if y'all have heard the big rage about that lately, but CBD oil, essentially, you have these receptors throughout your body, and it's actually called your endocannabinoid system, and your body makes these natural endocannabinoids that bind these receptors, but unfortunately, we just don't make enough of them due to environmental toxins, all the kind of stuff we've been talking about. So essentially, CBD oil binds these receptors and really helps with all different kinds of ailments. And that's why you hear so much about it, is because it's all over your body. So guess what? One person can have it and sleep amazing. One person can have it and really helps with stress or anxiety. Another person with pain. I've really listed it here because of inflammation and just helping with inflammation. It's a big target for that. Low dose naltrexone, that's the last one that I was talking about with the prescription medication, which we'll kind of go into now. So this is a compounded prescription medication. You'll see it commonly prescribed for all different kinds of autoimmune conditions. Fortunately, they're coming out with more and more research on different autoimmune conditions, which is amazing. And the huge advantage is very low side effect profile compared to some of these other medications that patients are being put on for some of these conditions. The most common one is that first one. You'll see vivid dreams, usually in the first couple weeks, if it happens. And then usually we see it decrease after that. Either they don't have it at all, or you'll see it decrease after that. Essentially what these do is they bind your opioid receptors. So they do this and they release endorphins. And they actually, overall, the mechanism works by decreasing inflammation. Okay? They've actually done studies and they turn down your inflammatory chemical messengers, those ones that I've been talking about that tell your body to ramp up inflammation. This medication actually is very targeted and geared toward turning down. I've written two websites up there. That way y'all have that in your notes and you can look specifically on so many different research on this medication. We'll go into it a little bit. First thing here I have is a review of therapeutic utilization. And as you can see, like very prestigious places are studying this. Dartmouth Medical School, they reviewed over 900 different articles about it, and they summarized the top ones. And the good thing for us is Crohn's made it into that top. So I'll kind of be going over some of the stuff they saw in that as far as studies. Did kind of want to go over, you may hear naltrexone. It actually is a commercially available medication, and it's used for either alcoholism or for drug overdoses. So you'll commonly hear that. That is at a very high dose. So doses over on the side here, 50 to 100 milligrams. When we're talking about low dose naltrexone, it usually is range from 1 to 5 milligrams, okay? And what they found is that these very low doses, turning down the inflammation is the result you get, versus so much on the side of more blocking the opioid receptors at those higher doses, okay? There's also some really good research in very low dose and ultra low dose for pain relief and helping people actually decrease their opioid use, but that's for another day. So this is the summary of low dose naltrexone and Crohn's disease. There's so many more different articles, but really want to highlight that first one up there. So they did a open label prospective study of 17 adults affected by Crohn's. They treated them with 4.5 milligrams of the naltrexone, which is the dose that we recommend working up to, and they did it for 12 weeks. And the majority responded with a 70-point decrease in Crohn's disease activity index. And that was 89% of the people that were part of the study actually reported a 70% decrease in their symptoms, essentially. And then 67% actually achieved a remission of symptoms. So meaning, they were gone completely as far as their symptoms go. With these IBD, you can have flare-ups, ups and downs, and that's the biggest thing, is really trying to achieve that remission point for patients. They actually did a case in pediatrics showing it was safe in children. So, children handling the side effects and all of that, in addition to just safety in general. The other big one here, open label perspective, 19 adults affected by Crohn's and 28 by ulcerative colitis, and 74.5% showed clinical improvement, and 25.5% achieved remission. So very, very cool stuff seeing effects in patients. Dosing protocol, we recommend starting at a low dose, 1.5 milligram, and titrating up to that 4.5. And you do that over a couple weeks. Unfortunately, gut symptoms are the ones that take the longest. So patients always ask me when they're starting a medication, whether that's a hormone replacement or any sort of thing that they're feeling, how long before I feel an effect? You may, like with the naltrexone, the good thing is you may notice improvement in other things like energy. We have seen that in patients where some of their other outstanding symptoms are improved. But the ones for gut, it may take up to 120 days. Average is about 3 months. But did get a patient-reported success about 78 to 84. This is another key article. So over the course of 3 months, 74.5% were considered to have a positive response, with a 25.5% achieving full clinical remission. So that was one that I was talking about. They actually looked they did the endoscopy and looked and saw positive changes. I actually have pictures of different patient cases for not only Crohn's disease, but ulcerative colitis. So both of those cases. I will say Crohn's disease has much more evidence, a lot more trials, a lot more studies done in Crohn's disease. But for ulcerative colitis, it's a lot more patient-based reports that we're getting as far as success on that. So that's in there. Moral of the story, advantages and disadvantages of low-dose naltrexone. Advantages, very low cost, minimal side effects. That's going to be the biggest ones that I talk to patients about. Disadvantages, really it comes down to disadvantage, making sure there's data on long-term safety. We don't have, this has been a kind of a more new novel approach, so we don't have those long-term studies. And I think also just educating doctors. That's why it's so awesome when we get like a person, Lena, she's a health coach from a doctor's office, to come and learn about these different approaches and novel things that we see. But really, ultimately, when we're talking about IBD, it's really about the inflammation. So what we're here for is to say, okay, what is going to be the best target for you? What's going to be the most realistic thing for you to integrate? And then also, always we like to offer some sort of therapy on the side, whether that be supplements or low-dose naltrexone. So I want to say that's the end of my, yes. So end of my presentation, but yeah, it's all about the inflammation, guys. It really is. Any questions, comments, concerns?